it early and fix the root cause. PCOS is everywhere, but most women with PCOS don't even know they have it. They're told it's just your hormones, it's stress, lose weight and you'll be fine. Meanwhile, their periods are all over the place, their skin is breaking out, the hair is thinning, and the weight is stuck, and fertility anxiety is through the roof. If that's you, I want you to hear this very clearly. It's not your fault, and there's a path forward. Today we're going to make PCOS or polycystic ovarian syndrome simple. What it is, why it's missed, what to test, and what actually helps. We'll start with what PCOS really is. PCOS is not cysts on your ovaries. PCOS is a hormone and metabolic condition with three main pillars, and you only need 2 out of 3 to diagnose it. First, signs of high androgen, things like adult acne, extra hair on the face or body, or thinning hair on the scalp. Second, irregular ovulation, cycles that are very long, very unpredictable, or fewer than about 8 periods a year. Third, ovaries with lots of small follicles, or a very high egg count on blood tests like AMH, which is anti-Mullerian hormone. For teenagers, ultrasounds can be tricky, so we focus more on very irregular periods, plus the androgen signs like acne and hair changes. If your cycles are chaotic, and if your skin and hair are screaming hormone problem, we should not just throw a pill at you and say, see you when you want to have a baby. Why does PCOS get missed? Why does it get missed for years? It's because we normalize symptoms. We say that teenage girls have weird cycles. Everyone's stressed. Lots of women struggle with weight. And then we mask everything with the pill. Your bleed may appear to be regular, but underneath there may not be an ovulation happening. And insulin resistance may be quietly getting worse, and egg quality may be slowly declining. By the time someone takes it seriously, we are now in the fertility clinic, and the system calls that bad luck. It's not bad luck, it's actually underdiagnosis. So what are the root causes under the hood? Because if we look under the hood, this is where you can actually take control. For most women with PCOS, we see a cluster of drivers. The number one driver is insulin resistance. Insulin, as you know, is the hormone that keeps your blood sugar in check. In PCOS, the body needs more insulin for the same result. High insulin tells the ovaries to make more androgens. That means more acne, more hair issues, and more cycle chaos. Number 2, visceral fat and inflammation. I'm talking about fat around organs. This fat is hormonally active. It releases inflammatory signals that messes with ovulation and hormone balance. Number 3, stress and the hypothalamic pituitary adrenal axis, or the HPA axis. Chronic stress, poor sleep, late nights, they change cortisol patterns and make insulin resistance and hormone imbalance worse. Number 4, genetics. PCOS often runs in families. So if mom, sister, or aunt has it, you might be at risk of having that. None of this is a character flaw, by the way. These are biology levers. And just so you know, the levers can be moved. So how do we manage it? It's through lifestyle, supplements, and meds. Now let's talk solutions, not just band-aids. We're going to build a stack of lifestyle, supplements, and medications when needed, and future planning for fertility. First, lifestyle foundations. Food. Prioritize protein and fiber. Dial down ultra-processed carbs and sugary drinks. Aim for slow, steady blood sugar instead of big spikes and crashes. Movement. You don't need to live in the gym, but strength training is a cheat code for insulin resistance. Add regular walking, especially after meals, to help glucose get into muscles, not stored as fat. Address your sleep and stress. If your sleep is wrecked and stress is constant, your hormones don't stand a chance. Sleep is hormone therapy. Take it seriously. And second, supplements, not magic bullets, but helpful tools when layered correctly. Common ones used in PCOS are inositol, which is myo-inositol, vitamin D, which is often low and worth correcting, and others like omega-3 and some insulin supporting compounds. And it depends on your doctor's plan, so you need to talk to your doctor about it. And number 3, medications. Traditionally, doctors have always used metformin, which is the medication that we give diabetics to actually improve insulin sensitivity. Now, in the modern era, we have more powerful tools which are called the glycogen-like peptide 1 medication, or GLP-1 agonist. For some women, this may be a very useful tool, especially who have significant metabolic syndrome or obesity. Hormonal contraception, the pill, or other forms of hormonal control, can help with bleeding and acne. But remember, the pill is only a symptom control. It's not a cure for PCOS. When you stop the pill, the PCOS is usually just unearthed again. PCOS and fertility is a huge topic. Now, I'll just simplify it, okay? PCOS can affect egg quality and egg quantity, so egg count over time. The tools that you can use early are to actually get an early test or a blood test for anti-Mullerian hormone or AMH level. This gives us an idea of the egg reserve. Okay, need to organize a pelvic ultrasound with a skilled operator who can do ovulation tracking. Some women may choose to freeze eggs earlier, not because there's something wrong, but because they want more control over time. The power move in PCOS is don't wait until you're trying for a baby. Check in earlier and ask the questions now. So, if you recognize yourself in this following matrix, your periods are irregular, unpredictable, you've got adult acne and unwanted hair or hair thinning, and you're gaining weight around the middle, even though you're trying hard, and you're exhausted and anxious about future fertility. This is your sign to stop blaming yourself. Stop accepting that it's just stress. Ask your doctor, your GP, or your specialist about what the diagnostic criteria for you for PCOS is. What are the signs of high androgen? Get your ovulation patterns, check for insulin resistance, check your AMH, and get a pelvic ultrasound. PCOS is common, but PCOS can be serious. But PCOS is definitely modifiable. The earlier you recognize it, the more time you have to change the trajectory of your hormones, your metabolism, and your future fertility. Thank you for watching this episode of FSD Doctor Talks. Until next time,